So pulmonary function tests, we're expanding with restrictive versus obstructive diseases, okay? And how we're going to use this. We got to, if someone comes to the medical professional and has respiratory symptoms, and it doesn't look like anything, I mean, it looks like something more than just the common cold or the runny nose, that kind of thing. There's something going on with probably something deeper into the lungs. They're going to do what we call pulmonary function tests to determine, is this a restrictive disease or an obstructive disease or neither, okay? You do this by an instrument called, or a process called spirometry, where we're going to use a spirometer to do this, okay? And that's what we use the machine over here for. So you do spirometry. It's a measure of the volumes of air going out of the lungs and into the lungs. You've got to compare those two, okay? So it distinguishes between the two groups of diseases, whether obstructive diseases, which means that something's going to block or obstruct the airway someplace in there, or a restricted disease where something is going to restrict the lungs from expanding. Again, obstructive diseases, they have problems exhaling. Restrictive diseases have problems inhaling. Obstructive diseases, as an example, like I said, is an old baggy, flabby balloon that's been blown up 4 billion times, whereas a restricted disease is more or less about those balloons to make balloon animals at your children's party kind of thing. It's hard to get the air in, okay? This is what spirometry, who here has done spirometry sometime in their life? Okay, about half of you. All right, basically what it is that you've got to blow into this machine. It'll collect the amount of air, and then you also have to inhale too. First you got to inhale, so you exhale everything first. This is what I would be doing with the machine if it was calibrated, but we don't have it calibrated. So what it'll do is that you exhale everything. Why do you put this clothespin on the nose? Right, because you want to be able to collect all the air. If you blow out and inhale, you want to make sure nothing gets in through your nose. You want to be able to collect everything here. So that's why they do that, okay? So you exhale first. I mean, all of it. As much as you could. And then you put this thing in your mouth and you inhale really fast, as much as you could, and then blow it out. So you're collecting all the air coming in with that machine, and then all the air that's going out with the machine. And they calculate how fast you could blow out all that air. And that determines, and the volume too, and that determines if it's restrictive versus obstructive. Let me get into this, okay? We have total ventilation here, okay? The total amount of air in the respiratory tract, okay, in 1 minute. Now we have the forced vital capacity. That's how much of the air you could forcibly take in a deep breath, let alone you expel. So this is a force of a FVC. The amount of air that you could expel out very fast. So I'm going to take a deep breath, and I'm going to blow. All right, it took about 4 seconds to do that or so, right? All of it out. That's the force, that's a forced vital capacity. How much of the air that came out when your lungs was fully filled, okay? Then we have something called a forced expiratory volume, an FEV. And they usually calculate this by a subscript of 1. They usually do this over 1 second. This is what we're talking about, and it's pretty easy to understand. If I do my forced vital capacity, and it took 4 seconds to do that, how much of that came out in the first second? That's what they're calculating. So the FEV1 is how much of the forced vital capacity came out in the first second. Was it 50%? Was it 80%? Was it 10%? How much came out? Does that make sense? Okay? So then we have this little formula. Yes, you'll have to do this for the practical exam. Okay? We have this formula called the Tiffeneau-Pinelli Index. Very easy to do. Okay? What you're going to do is get a percentage. how much came out in the first second of the total amount. It's a percentage. Does that make sense? If I had, I'm just giving you numbers. If I have, let's say, let's say 3 liters came out total, and 1 liter came out in the first second, then what's my index? 33. Pretty easy to understand. Okay? So it predicts us. Now, if we did the spirometry, you have to plug in all these numbers. It's different by the age. It's different by all these different factors here. So before you do the spirometry, you got to put in your age, your sex, believe it or not, the weight, the height. Even if you're Indian, black, or white, somehow that all the average person, like the average, just give you an idea, the average white male weighing 200 pounds at 5'9", at, let's say, at 40 years old, the average should be, let's say, 6 liters. Or let's say 5 liters. Okay? But it's different by height, it's different by age. Okay? It's different even if you've smoked or not. Okay? It changes, but they have like this formula that says what the average, what you should be, the predictive value. Okay? But it's changed for each person. This is the general rule. What's normal is between 70 and 85, depending on the spirometry machine that you're looking at. If it's going to be less than 70, it's some form of obstructive disease, severe obstructive disease. Okay? If it's greater than 85, you're going to have some form of restrictive disease. Now, I don't want you to memorize this. I want you to understand the concept. So this is how to understand it. You put pencils down. Everything is on here in this graph. Okay? Forget about these pictures for the moment. Just look at what's going on here. You're going to blow out all the air. So here's where liters are. Let's say 5 liters, and this is over time. So you're going to blow out everything. You blow out everything. That's your FVC. You blew out everything. But then it also, when you blow out in the tube, it also calculates how much came out in the first second. So here it's saying 5 liters came out total, but in the first second, 4 liters came out. Okay? So now you just do the index. 4 as be FEV1 divided by FVC. So what's the percentage? 4 divided by 5. 80. So in that case, 80 is normal. So that's what a normal curve would be. Okay? Your magic number would be 80. That's a good number. Okay? Anything more than that will be restrictive. Anything less than that will be obstructive. So let's talk about obstructive. Someone who's got an obstructive disease, are they gonna? Is it easy for them to exhale, or is it easy for them to inhale? Inhale. So it's going to be difficult for them to exhale because there's a lot of air trapping that's in there too. So they're going to exhale, and it's going to take a long time for that to happen, and they can't blow off as much as a normal person would because a lot of air trapping in there. There's going to be like a balloon that's been blown up 4 billion times. There's going to be a lot of air. If you let the nozzle go off, the air in the balloon will come out, but there's going to be a lot of air trapping there, right? So they're not going to be able to blow off 5 liters like an average person. They're only going to blow off, in this case, like 3 liters. Because the other 2 liters is left in the lungs. It's air trapped. So they're going to blow it off, and it takes a long time for them to blow it off. They can't blow off all the air. So here's their FVC. the total amount of air. In this case, it's about 3. Then they want to calculate how much came out in the first second. Not much. Maybe 1 liter. So here, in this case, and if I give you on a practical exam, I'm going to give you numbers that you can work with without a calculator. Okay? But here, FEV1 is 1.3, FEC is 3. So now you can just do 1 divided by 3, you get 42. So this is less than 80. So this has got to be an obstructive disease. Does that make sense? Is that how you use this? All right? Don't just memorize the number. You've got to understand how to read these things for the practical. Okay? Over here, let's look at someone with restricted disease. Now, they're going to blow out the air. There isn't going to be much air to blow out for a different reason than what's over here. It's because they can't get the air in, right? It's an inhalation problem. So they couldn't begin with a lot of air in the lungs anyway. So when they blow out, there's only going to be, let's say, 3 liters in there anyway, because the capacity is very small. Different reason for here. Here's air trapping. Here's because it's restricted. Most of it comes out very fast. This is like 3 liters that comes out. But in the first second, how much came out in the first second? Well, because they have a lot of elastic fibers around there, a whole lot's going to come out in the first second. So now, in this case, 2.8 divided by 3.1 comes to 90%. So if the number is very high, it's got to be a restrictive disease. Does that make sense? All right? I also have a little video, a 10-minute video on this also. The person talks. He's a very monotonous person. I found it on YouTube, but watch him with a cup of coffee, okay? But he does explain things very nicely about this whole thing over here, okay? And this is how they kind of look. I won't ask you about this, but this is how the newer ones are actually being done. If you go into respiratory therapy, you'll get to understand they do these kind of circles. But they're, but these are. They also put out these too, and these are a little. For me, they're a little bit easier. And for you guys, they're a little bit easier to understand. Okay. Questions about spirometry? Again, we won't have time to do that, but you need to understand the concept of it. No?